This is a follow-up to my previous videos looking at methods like smell training, supplements, and use of steroids in regaining sense of smell. We'll be looking at the use of platelet-rich plasma therapy in treating loss of smell. Your plasma is made up of water and proteins to support cell growth and provides medium for red blood cells, white blood cells, and platelets to circulate through the body. Your platelets help to promote the body's growth healing functions. Platelet-rich plasma is obtained by taking plasma from your blood and concentrating the platelets by running it through a centrifuge. This is a machine that spins around very quickly, causing the blood components to separate. These concentrated platelets, known as PRP, are then injected directly into the damaged tissue, which stimulates the cell's repair process, promoting faster healing and encouraging the growth of new healthy cells. PRP injections are famously used by athletes for injuries to tendons such as tennis elbow, hamstring muscle sprains, knee osteoarthritis, anterior cruciate ligament tear, and even hair loss. In terms of loss of smell, PRP is injected into the nose at the olfactory cleft, which now triggers the healing and growth process. It is thought that the PRP stimulates the olfactory system, perhaps regenerating new receptors. This is still in its research phase, as several trials are still ongoing and is not a proven treatment. However, some studies have shown improvement in loss of smell. A research paper in 2016 on 5 patients showed positive outcome, with 4 or 5 regaining smell completely after 4 treatment cycles, and is suggested as a last resort for those with complete loss of smell. Another study in 2019 in 7 patients with loss of smell for over 6 months who had no improvement in smell training or use of topical steroids for at least 3 months had a single injection of PRP. This showed some improvement in smell after 1 month for all 7 patients, with 3 of the 7 patients regaining 100% smell. In terms of COVID, as we know, the ACE2 receptor is what the spike protein of the COVID-19 virus binds to. This ACE2 receptor is also found in the cells of the lining of the nose and mucosa of the mouth, which is why COVID swabs are done of the nose and throat. So damage to these cells can lead to loss of smell and taste. Another study, this time with COVID patients, showed rapid recovery of loss of taste and smell within 3 days of the COVID diagnosis. So it is thought that early treatment using PRP leads to quicker recovery than without PRP. As even with PRP, you can still expect the recovery of loss of smell to take several weeks, so it is advisable to continue with other therapies such as smell training and supplements such as zinc and vitamin A. For further updates on loss of smell and future treatment options, please subscribe to my channel.